Good news for advances in the fight against HIV and AIDS. A prevention drug called Lenacapavir will be made cheaply available in 120 countries. However, critics say it excludes many countries where incidence is highest. Lenacapavir, given as a twice-yearly injection, has shown strong results for HIV prevention. For more on this, I'm now joined by Virologist Professor Tulio De Oliveira. Professor, appreciate your time this afternoon. Now, let's start off with a conversation on the overview or the current state of HIV infections in South Africa, particularly among high-risk groups such as women and young people.
Okay, yeah, good afternoon. Yeah, Ug, and very nice to talk to your viewers today. So in general, in South Africa, we have been having good news about HIV incidents, what it means, HIV transmission. HIV transmission has been going down, yeah, quite a lot, yeah, especially in the last 5 years, yeah. And then what was announced last week was two phenomenal results. One, it is a new therapy that you just mentioned, yeah, that we call Lenacapavir, or we call for short LEN, L-E-N, yeah, that it is done as an injection that the person only need to take twice a year. And when they did this new therapy, yeah, 0%, yeah, of the people that received them in South Africa and Uganda, which did not acquire HIV. So these were high-risk women, young women, yeah, that were exposed, but they did not acquire HIV. And that's maybe a game change in our area, which can potentially really decrease even further the incidence or new infections of HIV.
Now, Lenacapavir has shown strong results in trials conducted in South Africa and Uganda. What impact do you anticipate this drug will have on South Africa's HIV prevention efforts?
So what they did then, the next thing to do was to replicate that same trial in another 7 different countries, yeah. They also show extremely good results. Yeah, 99.9% yeah, reduction of acquisition of HIV. Yeah. And then that's where a lot of activism came through. Yeah, that this can be a game change at therapy. But the price of this therapy in, for example, United States of America is $42,000, almost like R1 million a year for the two doses. But then in a breakthrough announcement, yeah, around 2 days ago, the company called Gilead decided to make that drug basic almost free. We are estimating around $30 or $40, or this means like 500 Rand a year for the 2 injections. And furthermore, what they did is transfer that to 6 different big generic pharmaceutical companies based in Egypt, Pakistan, India, and the United States, so they could produce that therapy at high volume that may be needed to really decrease further transmission of HIV.
Now, Prof, there are campaigners who have said that the deal abandons many countries, particularly those in Latin America, who are in need of this drug because of the incidence of HIV in those territories. What's your comment on that?
So that's discussable, because the transmission rate of HIV in Latin America is much lower than Africa. So, and what I expect is that once that roll out first in the very high risk countries, so for example, they selected 120 countries, but 20 countries initially to have early access, and this is basic. All the 20 countries of high incidence, yeah, I wouldn't be surprised if that's then after is made available to other countries in Latin America. Yeah, so in general, I think that the therapy will be available where it needs the most, And then after that, then we will see if it's going to be available in what they call middle high income countries. The good news is that South Africa was approved to get the very cheap version, and every single of our neighbors, Botswana, Eswatini, Lesotho, Zimbabwe, and Namibia. So that may be a game change for our region.
Now, the one thing that's been mentioned about Lenacapavir, or certainly for the individuals that took it, is that these are individuals that were exposed to potentially to HIV. Does this mean that these individuals would have come into contact or had sex with other individuals that had HIV, and that it was then not transmitted to them?
Okay, so let me explain quick how these big trials are run. Yeah, so they were run with four main components. Yeah, that's the ones, and that's where all initially young women that receive the injection. Yeah, and then two other components that people that receive a placebo injection. This means a saline injection without the therapy, but they also receive antiretrovirals to prevent therapy. And the fourth arm, it is people that were not involved in the trial. Yeah. What was the difference? On the ones that received the injection, and we have 2,000 individuals, we got 0 infections. On the ones that receive the antiretroviral therapy that you have to take every day to prevent therapy, you had 50 infections, or this means an incidence of 2%. Yeah. And in the ones that did not receive anything, that were not part of the study, they had an incidence of 100 infections. So the results were very strong. So normally you compare similar groups that either received the placebo and other ways to prevent infection, or were not part in the study. And the study was highly significant. In reality, it was quite a surprise how well the results were, how good they were.
So how soon can we expect this drug in South Africa?
So I think that quite soon, because as part of the deal that was released 2 days ago, not only the company Gilead has involved 6 generic manufacturers, but until they can scale the production, they will be providing that at cost price. So now the process in South Africa is to register the therapy in our regulatory, what we call SAPRA, and then start making available to the population that want to prevent HIV. This means especially young individuals, young women, or people that are in risk to acquire HIV.
Okay, that's where we'll leave that conversation with virologist Professor Tulio De Oliveira, speaking to us about a new HIV prevention drug called Lenacapavir, which is administered via an injection and has achieved incredible results for the twice-yearly injection.